Coming up on this edition of the Paw Report, we're talking to Dr. Gregory Mauck from Kaskaskia Valley Animal Hospital in Sullivan, all about weight loss syndrome in older cats. Stick around to find out what you need to know about it. That's coming up next on the Paw Report. Production for the Paw Report is made possible by
Inyart Tire and Auto Center in Charleston and Mattoon. Inyart offers complete auto repair. Inyart Tire and Auto Center cares about our community and thanks you for being a responsible pet owner. More information at inyart.com.
Hello and welcome to this episode of the Paw Report. I'm your host, Kate Pleasant, and I'm joined by Dr. Mauck from Sullivan, and he's been here a couple of times before, right?
Yeah.
Since you've been here before, why don't you go ahead and tell us where you're practicing, first of all?
I've been back in Sullivan since 1987 and grew up there, and so it's home to me.
Okay, and so today, though, we're going to talk about weight loss syndrome in older cats, correct?
Right.
And that's something common that you're seeing?
Yes, that's a very common disease. We probably in a week see 2 to 3 cases of this.
That's
so
pretty frequent
yes.
then.
And so when we talk about a syndrome, kind of think about that in 2 different ways. You know, we think about, a lot of times in diseases, you think about a specific disease as a specific set of symptoms. But a syndrome, you can kind of think about it in 2 different ways. You can have a set of symptoms that's caused by a specific disease, or you can have a bunch of diseases which can all cause the same set of symptoms. And that's what weight loss syndrome in older cats is. It's a situation where this cat walks in the door and, we look at it, it's an older cat, it's lost a bunch of weight, so they all look alike just walking in the door, but there can be multiple, 15, 20 different things that could be causing that. There's a few of them that are real common, and so the vast majority of these cats have a few diseases, but there are other things, there could be multiple other things that can cause that.
So how do you narrow that down? Where do you start?
Well, it's kind of one of those things where you look at it and you get an idea off just from experience. And again, there's an old saying in medicine where if you hear hoofbeats behind you, it's probably horses, not zebras. So you kind of think about what are the horse things here? What are the common things that would cause this? But we always have to keep in mind the zebras that could be out there.
Right.
So the first thing we do is do a really good physical exam. And that's one thing a lot of times that's you don't think as much about it. That's kind of discounted. Everybody thinks about all the exciting stuff in medicine, all the blood tests and CAT scans and MRIs and all that, but those things really are not real useful if you're not doing a really good physical exam to start with. So that's really the backbone of medicine that kind of gets ignored sometimes. So that's the first thing we do, and a lot of times by doing that we can narrow things down and sometimes even get a diagnosis. So when at my exam, my best exam tool are these guys right here, my hands. So I've got my hands on the cat, feeling them, looking for things. And so probably the big thing I look at with my fingers is the abdomen. One of the major causes of weight loss in older cats is kidney disease. And so we're filling the abdomen, and we can feel the kidneys in a cat pretty easily, in most cats, unless, say, they're an obese cat. And of course, in this situation, that doesn't apply. So most of these cats that have lost weight, we can pretty easily feel their kidneys. And a normal kidney in a cat, a young cat, say a young healthy cat, is about this big around, and it's very smooth. Matter of fact, coincidentally, the corner of my exam table feels exactly like what a kidney feels.
Really?
It's a nice, round, smooth, and I have people feel that.
I was going to say something to compare it to.
And so, and I know about how big they ought to be. Almost all older cats have smaller kidneys, but they shouldn't feel knobby and weird. So if I reach in there and I find this little walnut-sized kidney that's hard and knobby, and it kind of feels like your knuckles on your finger, then I'm very suspicious that this cat has kidney failure, chronic kidney disease. So that's one of the big things. The other thing we're looking for in the abdomen are masses, tumors. and which is a unfortunate common thing we see. We get lots of abdominal tumors in dogs. We get less in cats. The bad thing in cats is they're often malignant. So if we find an abdominal mass in a cat, it's almost always a malignant tumor. So we feel for that. Look for those things. Feel the lymph nodes. Feel for enlarged lymph nodes. Another very common thing we'll talk about in cats is hyperthyroidism, overactive thyroid. So we feel for their thyroid. And there's a thing called the thyroid slip where you can run your fingers down. The thyroid's right here, right below your larynx. And you run your fingers down, you can feel this thing popping under your fingers if it's enlarged. A normal thyroid you shouldn't be able to feel. So I feel for that. And then I get my stethoscope and listen to the chest. Listen for lung disease, which is not common, but also listen to the heart. Listen for arrhythmias, murmurs, that type of stuff. That's not common either in cats. Very common in older people, older dogs, heart disease. In older people and dogs it's common. It's not common in cats. When we see heart disease in cats, it's usually more of a middle-aged problem. But anyway, listen for that, and we'll find that sometimes. So that's kind of the first steps, doing that really good physical exam and looking for some of those obvious things. Do you have a tumor? Do you have feels like you have an enlarged thyroid? Do you have knobby small kidneys? Do you have enlarged lymph nodes? Those types of things.
Kind of your basics.
Yeah, right, right. And so we can get a really good idea. None of that proves we have a disease other than if you have a large mass in your abdomen. But just because your kidneys are small and kind of knobby, they may still be functional. It may be that you're not in kidney failure. So, so the next big step is doing blood work and urinalysis. Those are the two big things. And that's the backbone of the clinical diagnostic stuff as opposed to, hands-on things. Doing those two things rules in and rules out the vast majority of the diseases we're worried about. And so we do a blood chemistry panel. We get urine and look at that. So the big things we're looking for in the blood chemistry panel is looking, what are your kidney numbers? What are the liver numbers? What about your glucose? Diabetes is very common in cats. We tend to see it a little younger, but I'll occasionally have a quite elderly cat come in who's never been diagnosed that has diabetes. But that does tend to be more of a older middle-aged thing. And that's also the other thing too is we think about, I say older cats, well what does that mean? 7 years old is a key year in dogs and cats' life. That's like turning 40 in a person. So that's when things start going kablooey. If, in cats that have diabetes, for example, we'll find some before 7, but most of them are older than 7.
Right.
Same thing with hyperthyroidism. I have diagnosed a couple of very young cats with hyperthyroidism, but almost all of them are older than 10 years old, the vast, vast majority of them. So, but even cats, if you say, okay, you're an older cat, well, you're 8 versus 16, that's a huge difference. That's the difference between someone who's 42 and 85.
Right.
So there's very different diseases that are going to show up during those time periods. So we look specifically at the age of the cat. That also gives us some information on what we're talking about. But in general, it's anything older than 7. But a 7 or 8 year old, 9-year-old cat's a big difference than a 15 or 16-year-old cat.
That would make sense. And so, once you've run these blood test panels and everything, and it comes back, say, with kidney failure, is there treatments? I mean, are there things you can do to prolong the life, or is that kind of it?
No, there's a lot of things that we can do with those situations. Just talking about those diseases that we're going to show up there, the big things that, the horses we're looking for, the big diseases that are going to cause this are kidney failure, hyperthyroidism, some cancers, diabetes is a huge one in the not quite so old cats. So those are the first things we want to do, rule out on the blood chemistry, look at those numbers and things and rule those things out. The other things that we think about that are more slightly zebra things is, do you have just dental disease? You know, we have these cats come in that have lost a lot of weight, and some of them have lost half of their body weight.
That's a
They
lot.
weighed 11 or 12, and now they weigh 5. You know, that type of
That's
weight
significant.
loss. Yeah. You know, you would think you always have some major disease. Well, it doesn't always have to be that way. Sometimes it's something simple like just dental disease. I've had dogs and cats both come in losing significant amounts of weight, and they just have icky, horrible teeth, and it just hurts to eat. And so we do a dental, clean their teeth, pull any teeth that are decayed, and they do immensely better. So it can be something as simple as that. Another problem that you don't really think about too much, but older people and animals start to lose their sense of taste and smell. And cats are really keyed into that. Cats are very picky about their foods and things, and if they don't have the right odor and it doesn't taste right, they just won't eat. So it can sometimes be something as simple as that, where, you know, this is just an older animal who's healthy. Everything on the blood work, the urinalysis, everything looks great. It's just, you know, they just maybe can't smell or eat it. And so we'll try different types of foods and things, warming their food up a little bit so that they can smell it better and stimulate their appetite that way. So there are some minor issues like that. But overall, most of these cats we find a significant disease process, which doesn't necessarily equate to being a fatal disease process. A lot of these things are highly treatable. Now, if we find a malignant abdominal tumor, that's not a situation that's usually really treatable. We remove those sometimes if they're removable. You know, occasionally we've resected intestines, removed parts of the intestines and things, and but that's usually a futile situation without going the next step, doing chemotherapy and all that type of thing. Even with full-blown treatment of something like that, you're probably not looking at extending their life just a few weeks to months.
And sometimes it's quality of life issues, I assume, at that point as well.
So that one's more of the extreme where we found something really bad. And we do have those situations where people walk in and their cat's acting okay. It's just, hey, he's losing a little weight. And then we have to tell them, hey, we found, you know, a disease where it's going to be fatal in a few weeks to very few months. So, but a lot of these things are pretty treatable. So let's say we do blood work and we say, hey, your cat has hyperthyroidism. That's a highly treatable disease. And so a lot of those cats live for years after diagnosis, and they look amazingly well and amazingly normal. So hyperthyroidism in cats is almost always caused by a benign tumorous type thing. It's almost never malignant. I've never had a case of a malignant tumor in the thyroid. But these are situations where there are little like micro tumors that develop in the thyroid and produce too much thyroid hormone.
Right.
And so there's a couple of different ways to treat that. There's an easy, expensive way. There's a pretty easy, not so expensive way, and there's a moderately easy, not so expensive way. So the big treatment is just like people, is just going and having radioactive iodine destroying your thyroid. And that works great, but that's pretty expensive. But I do have clients that do that because it's easy to do.
Right.
They take them, it's done, and you're cured. So the other ways to treat it, the old way that wasn't quite as easy but was reasonable cost-wise is using drugs that interfere with the production of thyroid hormone, like methimazole.
Right.
But those drugs you have to give usually twice a day, at least once. And so a lot of people, it gets kind of old giving your cat a pill a couple times a day. So, but that works really well. The new way that works, I'm finding works really well, and I didn't think it would. There's actually a diet produced, it's a prescription diet, and it is very low iodine diet. And so then the thyroid doesn't have the iodine to make the thyroid hormone. Iodine is a very important part of thyroid hormone. So if you feed a diet that's extremely low in iodine, then they can't make thyroid hormone. Now I really thought it was a bunch of hooey. But we tried it in 2 or 3 cats. It works amazingly well. And then all you have to do is just feed your cat this diet. And the big thing is they absolutely cannot have anything else other than the diet. Even a teaspoon of other cat food a day will be enough iodine, it won't work.
Really?
But if people are very good about it, it works fantastic. So hyperthyroidism really is pretty easily treatable and it's become easier with this diet.
That's very interesting. It's not, hyperthyroidism isn't something you really think about in cats,
Yeah,
but
super common.
well, it's good that
diagnose.
it's treatable too, though.
Yeah,
What about, when should you be checking with your veterinarian when your cat's losing weight? I mean, how much, how fast?
Well, any significant weight loss. And so, we think about, oh, my cat lost a pound. Well, that's no big deal. Well, to a cat that weighs 8 pounds, that means he lost 12.5% of his body weight. That would be like me losing 20 pounds.
Right.
So if over the next year I lost 20 pounds for no reason, I better be getting to the doctor because there's something going on. So if your cat loses a pound, then, you don't think much of it, but, percentage-wise, that's a lot of weight. So, but a lot of times people don't notice a pound. I mean, it really isn't that noticeable looking at most cats. So a lot of times we don't see them until they've lost 3 and 4 pounds. Or they may come in for some routine thing like vaccines, and like last year they weighed 9 pounds, and we weigh them this year and they look fine, just looking at them, but they weigh 7.5.
Oh, okay.
Yeah, that's significant. And so that's when we really need to start digging in and seeing what's going on.
So it's something a lot of times we may not even notice, but maybe the veterinarian will when we come in for our normal checkups. So that's another reason just for a normal checkup every year is to make sure that the weight's being monitored.
And the thing is too, when you have a gradual weight loss like that, if you got some horrible disease and you're acutely ill and lost a bunch of weight, it'd be obvious. But when this cat loses a pound over a year, it's so gradual that if you see them every day, you don't notice it. And it's just like you've probably run into people who, you haven't seen for a while and they've changed one, up or down weight-wise.
Right.
And, it may not be that noticeable if you see them every day, but you may see them, wow, you notice that difference. And so that's the same thing here. And it's also good to get a number. At home, you're not weighing your cat. So you don't realize, hey, he weighed 9, now he weighs 8. That's weird, and he's acting and looking the same.
Sure, I don't know that I'd want to try and weigh a cat at home either.
Yeah.
I don't know how well that would go necessarily, but so what would you recommend, diet-wise, because, gradual weight loss, but what about cats that are already overweight? Is there something we should be doing for them?
Yeah, and that's kind of the opposite end of the spectrum. Cats that are overweight is very common. I would guess is your typical house cat, probably more than not, they're overweight. Now, whether or not they're, dangerously overweight or not, that's another thing. You carry a couple extra pounds around and that's fine. But a lot of times we see cats that should weigh 8 or 9 and weigh 15, 16, which, and that is, morbidly obese. And what that term means is that they're so obese it makes them sick. To be morbid, that's sick. And so those cats need to lose weight. Now, cats, we have to be careful in losing weight because they have a liver that gets a little freaky when you lose too much weight too quickly. So they can develop a condition called hepatic lipidosis or fatty liver disease. They don't really know exactly what causes this, but it's a metabolic syndrome that occurs. And so cats that start to lose weight, their liver cells take up the fat, and then they start to malfunction. And then they start not being able to clear the bile from the body from the breakdown of the red blood cells. They become very, very jaundiced very quick. I mean, yellow as a banana sometimes.
Really?
They go into liver failure from that, and they stop eating. And then the cycle just really goes downhill fast. And you can get that, if you have a totally normal cat who's overweight, but he's healthy, he's fine, and restrict his food, or say he becomes stressed. Say you have company for the weekend, he's all stressed out, doesn't eat, that can start the cycle in him. And then, then things go downhill from there. And that is a treatable condition, but it's a difficult. A lot of those cats we have to put esophageal feeding tubes in and feed them through the tube, because they absolutely will not eat. I mean, you cannot force them to eat. You can put food in their mouth and they'll just gag it up, spit it up. They will literally starve themselves to death. And so we have to put these tubes in, feed them directly into their stomach to get their metabolism back to normal, get their liver straightened up, clear all that fat out of their liver. Then they'll feel better and start eating again.
Wow.
Before we were doing esophageal feeding tubes, the cats routinely would die from that because people couldn't get enough calories down them to turn things around. But with doing that, sounds like a very complicated thing, but it's actually a fairly simple procedure to put those in, and it saves lives. And we put those in for lots of other reasons too, but that has totally turned around the treatment of hepatic lipidosis doing those tubes. But otherwise, to get a cat to lose weight,
it's not easy, I imagine.
We want to do it carefully,
right?
And slowly. And so there are specific diet foods made for cats, but cats' brains and their systems work differently. Dogs and people, we're keyed into the carbohydrates, things like that we eat. Cats' bodies and their feelings of being full and things and how their body reacts to it is keyed into proteins and fats more.
Okay.
Because cats are, they're pure carnivores. In the wild, they eat meat, and that's about all they eat. Whereas dogs, people are omnivores, we eat everything. And dogs are much more omnivorous than what people think they are. They're not pure carnivores. And so their metabolism's more like a person's. And so we feed a dog a low-carb diet, low calories, high fiber, that type of thing. Cats, we feed them a lower calorie diet, but we really up their protein. They're keyed into that protein level type thing. And feeding them a low-carb, high-fiber diet a lot of times doesn't do it for them. So they need a different set of things. But just by restricting their food and feeding them, you can gradually restrict their food back, and that's fine. But you don't want to hey, my cat's overweight, I'm going to make him lose weight, and I'm just going to cut his food in half. And that's a good way with an overweight cat to throw them into that hepatic lipidosis if they're prone to it.
Liver problems.
We don't know which cats are prone to it. It's kind of one of those things where they're genetically prone to doing it, but another cat might not be. So you just really don't know. You could do two cats that way and one would be fine and one wouldn't.
Right. And so do you throw in exercise with
that would be
cats
good.
that are losing weight if you can? I know that's kind of hard for cats.
The best way to exercise a cat is just by playing with it. Cats are not going to go out for walks. You're not going to stick them on a gerbil or a hamster wheel and make them they just don't do stuff like that. So you just, you know how cats are. They just can't, you just pretty much can't make them do anything they don't want to do. So the best way to exercise a cat is to play with it and to do things like use the pointer.
Laser pointers,
laser pointer, and put up things for them to be, interested in, like hang strings with toys hanging off of it, so they'll run over there and bat that. And sometimes one thing that helps is just to get another cat so that they're interacting with each other, playing, doing stuff, and not just laying around and not doing anything all the time.
Right. Okay, well, Dr. Gregory Mauck from Sullivan, we appreciate you coming down and talking about weight loss syndrome in older cats. I think we've learned a lot today, so thanks for coming.
All right, thank you.
Did you know full episodes of The Paw Report are on YouTube? They can be accessed at www.youtube.com/WEIUTV. Then just go to the Paw Report playlist and select the episode you want to see.
The purpose of the name game is to teach the dog to respond to its name as a cue. The action we're looking for is for the dog to turn and orient to you. It does not have to sit, it does not have to do anything except look at you. The cue is the dog's name. The word that we use to indicate to the dog that he's done the exercise correctly is yes, and that is followed by a reward, which can be either a treat, a toy, or a life reward. For example, letting the dog out into the backyard. That's a life reward. Okay, so I'm waiting until Pepper is interested in something else, and then I say the cue, Pepper! Yes, what a good dog. Okay, and that is his release word, meaning he can go and do whatever he wants to now, because all I wanted was for him to orient to me. Now, praise is also important because we're going to phase out the treats very quickly. So you want to be sure that you praise the dog, you use a high tone of voice, and you say something the dog likes.
Pepper. Yes, yes, good girl, yes. Good girl.
Pepper. Yes. What a good dog. Very nice. Very nice. Okay. Now you can tell that Pepper, I was going to use some physical petting. Pepper did not respond well to that, so I'm not going to do that right now. But for your own dog, that is a very positive thing for many dogs.
Pepper. Yes. Good girl. Good girl, yes.
Production for the Paw Report is made possible by
Inyart Tire and Auto Center in Charleston and Mattoon. Inyart offers complete auto repair. Inyart Tire and Auto Center cares about our community and thanks you for being a responsible pet owner. More information at inyart.com.